You are sitting in the doctor's office. Blood tests are back. The words metabolic syndrome, high cholesterol, and statins float in the air like heavy clouds. Your heart pounds, not just from anxiety, but from the sudden thought, is my body already damaged? Am I late? Today, we will gently untangle this fear, guided by the insights of Barbara H. Roberts and the science behind statins and heart health. On one side, your doctor urges you should start a statin. On another, a friend warns, my muscles hurt for months. Online, articles shout conflicting truths. In this noisy crowd, Barbara H. Roberts, a cardiologist, steps forward with a quieter, thoughtful voice. She asks not, are statins good or bad, but for whom and at what cost? And what are the alternatives? That is the question we will explore, slowly and clearly. Metabolic syndrome is not a single disease, but a web of conditions. Increased waistline, high blood pressure, elevated blood sugar, high triglycerides, and low HDL, the so-called good cholesterol. Each thread alone seems manageable, but together, they quietly increase your risk of heart attack and stroke. It can feel like waking up in a net you never saw being woven. Yet, understanding the web is the first step in slipping free. Cholesterol is often painted as a villain, yet it is also a building block of hormones, cell membranes, and vitamin D. Think of it as bricks used to build both houses and walls. LDL particles, often called bad, can deposit cholesterol in arteries, especially when inflamed. HDL helps carry it away. The danger is not cholesterol alone, but how it travels, where it sticks, and whether the vessel walls are inflamed and vulnerable. Statins are among the most prescribed medications in the world. They lower LDL by blocking an enzyme in the liver that helps make cholesterol. For some, they reduce the risk of heart attack, especially after a previous event. But when a pill becomes popular, it can seem like a universal solution, even for people whose benefit may be small or uncertain. Barbara Roberts challenges us to ask, am I the person this pill was truly designed to help? One key idea from statin research is prevention. Secondary prevention means trying to prevent another heart attack in someone who has already had one. Here, statins often show clearer benefit. Primary prevention is trying to prevent a first heart attack in someone who is only at risk. For those with metabolic syndrome but no prior heart event, the picture is more complex. The possible benefit becomes smaller, and side effects may weigh more heavily. You may hear, this statin lowers heart attack risk by 30%. It sounds powerful, but a 30% relative reduction might mean that in 100 people, 3 have an attack instead of 4. One fewer person, not 30. For some, that one is priceless. For others, daily side effects may not feel worth the small absolute gain. Barbara Roberts encourages patients to understand this difference so decisions are based on real numbers, not just impressive-sounding percentages. If you have metabolic syndrome, your heart lives in a different environment. Higher blood sugar, more visceral fat, chronic low-grade inflammation. Arteries face harsher chemistry every day. Statins can lower LDL, but they do not erase the sugar spikes, the sleep debt, or the stress that quietly erode vessel walls. Barbara Roberts repeatedly reminds us, medication can be a tool, but it cannot replace the daily choices that rebuild the environment around your heart. Inside your liver, a complex assembly line builds cholesterol. Statins block a key worker called HMG-CoA reductase. Production slows, the liver pulls more LDL from your blood, and numbers on a lab report fall. Yet, the same pathway also makes CoQ10, an important molecule for energy and muscles. When that declines, some people may feel fatigue or muscle pain. This does not happen to everyone, but it is part of why listening to your body is essential. Large trials show that people who have already had a heart attack, bypass surgery, or stents often gain meaningful protection from statins. In these high-risk hearts, even a modest absolute benefit may be quite important. For patients with metabolic syndrome plus previous heart disease, Barbara Roberts acknowledges that statins can be part of a life-saving plan. But even here, she insists they should be combined with lifestyle changes, not used as a reason to give up. In people with metabolic syndrome but no prior heart attack, studies are less clear. Some show small reductions in events, others show minimal benefit, especially in older adults or those at lower overall risk. Barbara Roberts questions blanket prescriptions in this gray zone. She urges careful calculation of individual risk and open discussion about what matters to you: length of life, quality of life, possible side effects, and how strongly you value medication versus lifestyle approaches. For many, statins cause little trouble, but others experience muscle pain, weakness, memory lapses, or digestive upset. These may start as whispers, sore legs after a short walk, unusual fatigue, a name you cannot recall. In Barbara Roberts' clinic, she listened carefully to these stories, refusing to dismiss them as just aging. Your symptoms are messages, not annoyances. If you take a statin and feel unwell, it is important to discuss this with your physician. Statin-related muscle symptoms can range from mild aches to, rarely, serious breakdown of muscle tissue. Scientists suspect reduced CoQ10 and changes in muscle energy use as contributing factors. Patients often describe a heavy flu-like ache, different from post-exercise soreness. Barbara Roberts describes people who went from daily walks to barely climbing stairs. While these severe reactions are uncommon, recognizing them early and seeking medical guidance can prevent lasting harm. Some patients tell of walking into a room and forgetting why, misplacing familiar objects, or feeling mentally slower after starting a statin. Research on this is mixed. Not all studies agree. Barbara Roberts does not claim that statins always harm memory, but she insists that each person's lived experience matters. If your mind feels different after starting a statin, do not suffer in silence. A careful conversation with your physician may reveal safer options. Because statins work in the liver, doctors often check liver enzymes. Mild, temporary elevations can occur without real damage, but large or persistent rises may signal trouble. Barbara Roberts teaches patients that lab values are shadows on the wall, clues, not the whole picture. Symptoms like dark urine, jaundice, or severe fatigue need urgent evaluation. If you notice unusual changes while on a statin, please consult your physician promptly for proper assessment. Several studies suggest that statins can slightly increase blood sugar and the chance of developing diabetes, especially at higher doses or in those already at risk. For someone with metabolic syndrome, this is crucial because blood sugar is already fragile. Barbara Roberts urges balancing possible heart protection against this metabolic cost. She encourages careful monitoring of glucose, not just cholesterol, and adjusting treatment with your physician if sugar control begins to slip. Imagine Anna, 52, with metabolic syndrome, a rounder waist, borderline high blood pressure, slightly elevated fasting sugar. Her LDL is modestly high. She has never had a heart attack. Her doctor quickly prescribes a statin. Within weeks, her legs ache every evening. She wonders, is this aging or the pill? Reading Barbara Roberts, Anna learns to ask, what is my actual risk? How much benefit can I expect? Are there other first steps? Doctors often use risk calculators that combine age, cholesterol, blood pressure, smoking, and diabetes to estimate 10-year heart risk. These tools can guide decisions, but they are not crystal balls. They are built on populations, not on you as an individual. Barbara Roberts warns that heavy reliance on such calculators may push some lower-risk patients into lifelong medication while underestimating others. She invites you to see them as one tool among many, not as destiny. In a world where guidelines often lower normal cholesterol targets, more people qualify for statins every year. Barbara Roberts questions whether drug company influence and fear-based messaging have widened the net too far. Many with metabolic syndrome already take pills for blood pressure, sugar, and more. Adding another may feel like drowning in prescriptions. She invites a pause to ask which drugs are truly necessary, at what dose, and for how long, in collaboration with your physician. Many landmark statin trials were funded or influenced by pharmaceutical companies. While this does not erase their value, it raises questions about design, reporting, and which results are highlighted. Barbara Roberts, as a cardiologist, peers behind the curtain, examining which outcomes improved and which were quietly neutral. She models critical thinking, loving science, yet aware of its human and financial entanglements. As a patient, you deserve transparency about who paid for the data guiding your life. Over time, recommended LDL targets have fallen. What was once acceptable became borderline, then high, even if your actual risk changed little. Barbara Roberts argues that chasing ever lower LDL at all costs may lead to higher doses and more side effects, with modest gains. For someone with metabolic syndrome, the real question may be, how much risk reduction will this specific LDL change bring to me personally? Numbers matter, but so does context. Heart attacks often occur when a plaque in an artery suddenly ruptures, like a fragile scab breaking open. The stability of plaque, how tough its cap is, can matter as much as the total amount of cholesterol within it. Statins may modestly stabilize plaques for some patients, but inflammation, smoking, stress, and blood sugar swings also weaken them. Barbara Roberts reminds us that improving plaque stability is not only about a pill, it is also about calming the fire around your arteries. Have you ever seen an advertisement that shows a man suddenly clutching his chest with a voice warning, "Don't wait until it is too late"? Fear is powerful and companies know it. Barbara Roberts is not against preventing heart attacks. She has dedicated her life to that goal. But she warns that exaggerated fear can push people into choices they do not fully understand. Instead of choosing from panic, she invites you to choose from informed courage. Mr. Lee, 60, has metabolic syndrome and a family history of heart disease. His doctor prescribes a high-dose statin. Soon, he is too tired for his evening walks and believes his decline is inevitable. When he finally voices his concerns, an adjustment to a lower dose, plus focused lifestyle changes, brings back his energy. Barbara Roberts shares such stories to show that treatment is not all or nothing. Dose, type of statin, and non-drug strategies can all be tailored. The heart of Barbara Roberts' message is simple. You are not a passive object. You are part of the medical team. Shared decision-making means your values, fears, and goals belong in the conversation as much as your cholesterol numbers. Instead of silently nodding, you can ask, what if I try lifestyle changes first? Or what is my risk if I do not take this? A respectful physician will welcome these questions and consider options with you. When you see your physician, going in with clear questions can change everything. Barbara Roberts suggests asking, what is my 10-year heart risk? How many people like me must take this drug for one to benefit? What side effects should I watch for? Are there non-drug options to try first or alongside? Bringing a written list can steady your voice. Medical choices are serious. Having this dialogue with your doctor is essential to safe, personalized care. For metabolic syndrome, lifestyle change is not a vague slogan. It is potent medicine. Modest weight loss, improved diet, regular movement, better sleep, and stress reduction can lower blood pressure, blood sugar, and triglycerides, often more broadly than a single pill. Barbara Roberts emphasizes that these changes are not easy, but they reshape the entire terrain in which your arteries live. For some, they may reduce or delay the need for statins. For others, they powerfully complement them. Every meal is like a message to your blood vessels. Diets rich in colorful vegetables, fruits, whole grains, legumes, nuts, and healthy fats can lower triglycerides, improve insulin sensitivity, and support HDL. Patterns like the Mediterranean style with olive oil and fish are linked to fewer heart events. Barbara Roberts highlights that food is not just fuel. It is one of the most consistent, gentle ways you touch your arteries every single day. For many with metabolic syndrome, the bigger enemy than fat is excess sugar and refined carbohydrates. White bread, pastries, sugary drinks, and sweets spike blood sugar and insulin, driving triglycerides up and HDL down. Over time, this fuels fatty liver and artery damage. Barbara Roberts encourages shifting focus from simply avoiding cholesterol to taming sugar. Choosing complex carbs, fiber, and less processed foods can quietly reverse much of this chaos. Regular movement, walking, cycling, dancing, even gardening, acts like a multi-targeted drug. It improves insulin sensitivity, lowers blood pressure, raises HDL, and reduces stress hormones. You do not have to run marathons. Even 30 minutes of brisk walking most days brings measurable benefits. Barbara Roberts often saw that patients who move consistently, even gently, change their lab numbers and their mood. For hearts living under metabolic syndrome, motion is one of the kindest gifts. Short, fragmented sleep raises cortisol, disrupts appetite hormones, and worsens insulin resistance, pouring gasoline on metabolic syndrome. It can elevate blood pressure and make cravings harder to resist. Barbara Roberts highlights that healing the heart is not just a daytime project. Gentle evening routines, a dark, cool bedroom, and consistent sleep and wake times can quietly restore hormonal rhythms. Supporting sleep may magnify the benefits of any treatment plan, with or without statins. Chronic stress bathes your arteries in adrenaline and cortisol, tightening vessels and promoting inflammation. Anger, loneliness, and constant worry can be as real a burden as high cholesterol. Barbara Roberts saw hearts break not only from plaque, but from grief and overwork. Practices like deep breathing, supportive relationships, counseling, or mindfulness are not soft medicine. They are structural repairs for your nervous system. Calmer days can mean calmer arteries. Losing even 5 to 10% of body weight can significantly improve blood pressure, triglycerides, and blood sugar. Imagine carrying a heavy backpack every moment. Dropping just part of it changes how you move and breathe. Barbara Roberts encourages realistic goals. Not instant perfection, but gradual, sustainable shifts. For metabolic syndrome, modest weight loss can sometimes reduce the need for higher statin doses, or even for statins at all, always in coordination with your physician's guidance. It is tempting to hope for a single pill that allows you to ignore food, stress, and sleep. Statins may lower LDL impressively on paper, but Barbara Roberts warns that they cannot erase tobacco, sugar, or chronic overwork. For metabolic syndrome, relying only on medication is like mopping the floor while the faucet is still running. Real healing means turning down the flow, addressing root causes, while sometimes also using the mop when needed. Despite her concerns, Barbara Roberts is not anti-statin. For some with metabolic syndrome, especially those with known heart disease, very high LDL, or certain genetic conditions, statins can be an important layer of protection. The key is matching the intensity of treatment to the intensity of risk. In these cases, she still recommends the lowest effective dose, careful side effect monitoring, and robust lifestyle support. A statin can be a shield, but it works best alongside healthier terrain. In lower risk individuals, no prior heart disease, only mildly elevated LDL, and modest overall risk, Barbara Roberts urges greater caution. For these patients with metabolic syndrome, aggressive statin use may bring small benefit, but higher chance of side effects like muscle pain or sugar elevation. She suggests that in such scenarios, a thorough lifestyle trial with close medical follow-up may often be a reasonable first step. Any medication decisions in these cases should be made with your physician. Not all statins are identical. Some are more potent, some last longer, some may have different rates of certain side effects. In Barbara Roberts' experience, a patient who struggles with one statin may tolerate another or do well at a reduced dose. Timing the dose, for example at night, can also matter since your liver makes more cholesterol while you sleep. This is why adjustments with your physician can be so powerful before abandoning treatment entirely. Some clinicians, including Barbara Roberts, discuss CoQ10 supplementation for patients on statins who develop muscle symptoms, since statins may reduce CoQ10 production. Evidence is mixed, and not all guidelines endorse this, but some patients report relief. Other supplements like omega-3 fatty acids may help triglycerides. However, supplements are not automatically safe or effective. Before starting any supplement, especially if you have metabolic syndrome or take medications, consult your physician or pharmacist. Red yeast rice, a traditional fermentation product, contains natural statin-like compounds. Some people see it as a natural alternative. Barbara Roberts reminds readers that natural does not always mean safer. These products can still lower cholesterol and may cause similar muscle or liver side effects, especially if quality control is poor. If you are considering red yeast rice or other alternatives, it is vital to involve your physician so interactions and risks can be carefully assessed. After reading about side effects, some people feel tempted to throw their statin bottle away. Barbara Roberts strongly warns against sudden, unsupervised changes, especially if you have known heart disease. Abrupt stopping may raise risk in some situations. If you feel your statin is harming you or not, right for your risk level, this is precisely the time to speak with your physician. Any change in dose, type, or timing should be planned together, not done alone. Whether you take a statin or not, living with metabolic syndrome means an ongoing conversation with your body. Regular checks of blood pressure, fasting sugar, A1C, lipids, and waist circumference are like watching the dashboard while driving. Barbara Roberts encourages patients to track how they feel, not just their lab reports. New muscle pain, digestive changes, memory shifts, or deep fatigue deserve attention. Share these signals with your physician so your plan can evolve safely. Metabolic syndrome is often tied to life stories. Long work hours, caring for family, emotional eating, lack of safe spaces to exercise. Barbara Roberts sees beyond numbers to the person in front of her. Healing may mean changing a job, setting boundaries, or asking family for support. Statins do not fix loneliness or exhaustion. Your heart lives inside your life. Changing one often means gently adjusting the other. Hearing the words metabolic syndrome or seeing a high cholesterol number can feel like a sentence. Barbara Roberts wants you to know it is a signal, not an ending. Many patients in her care saw significant improvement through combined lifestyle work and, when appropriate, carefully chosen medications. Arteries can become calmer, blood sugar more stable, weight more manageable. Hope is not naive. It is a rational response when you have tools and partners in your healing. Change does not happen overnight. Barbara Roberts saw patients succeed when they chose 1 or 2 realistic changes at a time. Walking after dinner, replacing sugary drinks, setting a regular bedtime. These small steps, repeated, shift the direction of your health like a ship's rudder. For metabolic syndrome, progress is measured not only on the scale or lab report, but in how you breathe, sleep, and move through your day. Instead of seeing metabolic syndrome as a curse, Barbara Roberts invites patients to see it as a wake-up call. Your body is raising its hand, asking for a different future. That call may include statins, or it may focus on lifestyle first. Often, it includes both. What matters is that you do not ignore the signal. The earlier you respond, the more easily arteries, pancreas, and liver can heal before damage becomes fixed. Barbara Roberts emphasizes that you have the right to clear explanations, second opinions, and time to decide. You can ask for copies of your lab results, request interpretation in plain language, and decline treatments you do not understand. You also have the responsibility to engage honestly, share symptoms, follow agreed plans, and show up for follow-ups. When both patient and physician bring their full attention, decisions about statins and metabolic syndrome become safer and more humane. No one heals metabolic syndrome alone. Barbara Roberts saw better outcomes when patients had allies, family members who joined walks, friends who cooked together, online groups sharing recipes and encouragement. Share your goals and concerns about statins and lifestyle with trusted people. Let them know how to support you, whether by reminding you of appointments, joining you in exercise, or simply listening when you feel overwhelmed. Some side effects of statins or metabolic syndrome, like fatigue and muscle weakness, are often dismissed as just getting older. Barbara Roberts encourages a different view. Aging does not always have to mean losing your spark. If your energy shifted after a new medication, or over years of neglecting sleep, movement, or food quality, part of that decline may be reversible. With your physician's guidance, adjustments, and lifestyle work can bring back more vitality than you expect. By now, you may feel both more informed and more aware of complexity. That is healthy. Barbara Roberts never offers a one-size-fits-all rule. Instead, she offers a framework. Know your real risk, understand potential benefits and harms, strengthen lifestyle foundations, and then decide, together with your physician, whether a statin, at what dose, fits your values and body. This decision may change over time as your health and life change. As we close, I invite you to pause and ask, what is one gentle action I can take this week for my metabolic health? Maybe it is scheduling a conversation with your physician about statins. Maybe it is a 10-minute walk after dinner or swapping one sugary drink for water. Please remember, this video is for education, not personal medical advice. For decisions about statins, metabolic syndrome, or any treatment, consult your own physician. If this journey helped you, please subscribe, like this video, and share it with someone who may need hope and clarity today.